Welcome back. When it comes to major dental reconstruction, it's important to find a dentist with proper credentials that you can trust. And Dr. Matthew Nawrocki of Jacksonville Dental Specialists is here today to talk about what consumers should look for when it comes to dental implant treatments. Good to see you, man.
Yeah, good to see you.
So we're talking about, you see sometimes in advertisements or somewhere where they're promising like real quick, whole mouth reconstruction. We've talked about this a bunch. People need to be careful what they're getting into, right?
Yeah, they really do. We are entering in a time in a day and age where very high quality, life-changing dentistry, reconstructive dentistry can be offered much quicker, much more efficiency for a lot more people. But it needs to be done correctly. It needs to be done in the right context. And unfortunately, a lot of what we hear through different media and through advertisements and whatnot is really a marketing gimmick. It's just something to get you in the door, and then, oh, and then this is the actual effect. Or maybe it's forcing a situation that really shouldn't be done, or talk about the pros and cons. The likelihood of having negative outcomes is very real, and that's a conversation needs to have. So you need to do your due diligence. The technology and the ability certainly exist, but for some people, we're all different. No two persons or situations the same, and they really need to be approached that way. And so as specialists, we're really on the cusp of this, and we're able to walk our patients through this much more predictably, much safer, so that ultimately your outcome is long lasting, it's impactful, it's meaningful. It's not just here today, gone tomorrow, so to speak.
Well, one of the things that probably developed that is because people were coming with the question of, hey, I need this quick because, hey, I got a wedding. Maybe it's Meghan Markle's dad.
Yeah, exactly.
Needs to get some
maybe you need to get to the royal wedding.
But there are people that have, I have a big event coming up, and I can't not have teeth at the
Absolutely.
event. So how do you help those folks?
So today, this day and age, immediacy is always on the forefront, and there are some people that, through life events or big events coming up, they have some very clear expedited timings. So there are a couple wonderful options. There are those patients who really want the final permanent solution, now, and then there's some people that really want something permanent fixated, but they actually have the other. They need to figure out a way to kind of transition or phase this, but in a more permanent fixate solution. And so our express option is a very good solution for these people, done in the right situation, done in the right case. Because again, we don't want to sacrifice your safety, your prognosis, the predictability, just simply for immediacy. And so for some patients where everything is going in your favor and we can make this happen, it's sometimes as little as one surgery, and within even a few days after that surgery, even a day after, your permanent teeth can be put in. Or on some people who really need to stage through this, a long-term, maybe transitionary prosthesis can be used, and it's a very strong, milled, highly aesthetic solution, and it solves a problem for that individual.
Well, one of the things people are looking to do is they want, you said every mouth is different, but everybody's needs are different.
Absolutely.
But you guys really let them get involved in the process.
Yes.
Right? They can pick you can pick your smile?
Yes. I mean, you don't want to put everyone in the same category. From aesthetics to materials, we're all different. We have different goals and desires. It's no different than if you were building a house. We all have different wants and tastes and needs. And so when it comes to tooth color, size, shape, orientation, you have to build this thing so that it's highly aesthetic, but it's natural. It's in harmony with you, your person, your biology, what's your criteria for success. So we really, it's not that we encourage, it's that it's an integral part of it. It's a team. You're an integral part of that team, not just us. And so we absolutely want to involve you in that.
Talk about some of the patients that are prime and that should be coming in and getting consultations.
Absolutely.
From you.
So there's some practices in town, all specialists under one roof, but the one specialist that every one of them forgets is the prosthodontist. And so we are, I think, the only place that has an actual prosthodontist and your other specialists under one roof. And that's kind of like leaving out the architect or the general contractor. If you were building a house, you wouldn't do that. And so we have that unique ability, and we're able to handle a whole host of patients. Some of them have a lot of dental disease acquired. Maybe you weren't born with teeth. Maybe you have other health concerns like sleep apnea or TMJ, and you have a lot of compounding issues there. Or if you have aesthetic concerns, there is not a area of dentistry that has cosmetic dentistry as a specialist. So the American Dental Association has relegated prosthodontists to be the de facto specialists in cosmetic dentistry or aesthetics. So all those types of patients kind of start by getting in and seeing a prosthodontist, incorporating that team of specialists effect, and it's something we can help you with.
Besides coming in for a consultation, one of the best ways people can get a lot of questions answered, besides also watching First Coast Living each week and catching them on here, is you guys have a seminar?
Absolutely. And so education is probably key to helping you make a decision that ultimately you're comfortable with. So our next one is tomorrow at 6:30 p.m. and we talk about all the different tooth replacement options, implants, so that you can get some general education and then ultimately make an informed decision that you can feel comfortable with.
And most people that come to that, you said transition from that into a consultation?
Yes, absolutely. So after you get this knowledge and education, it's now you need to do something. It's like everything. When you learn something, now you need to apply it to help yourself out. And so many of those patients then, so that we can further that conversation as it relates uniquely to you, we'll set you up with a consultation. We typically spend anywhere from, between myself and our coordinators and everything, an hour and a half, 2 hours. So it's very informative.
Good stuff. There you go. Watch First Coast Living first, then go to the seminar, then go to consultation. There you go. We appreciate Jacksonville Dental Specialists for being here and sharing this information again. And for more information, visit JacksonvilleHYBRIDGE.com. You can also call 904-584-3867.